The neuroplastic nature of pain. Neuroplasticity is the brain's incredible ability to reorganize and form new neural connections throughout a person's life. This extraordinary function extends well beyond learning and memory, particularly influencing how we perceive and manage pain. Recent studies have yielded substantial evidence indicating that pain can be deeply neuroplastic, illustrating that our brains can adapt, recalibrate, and sometimes intensify pain signals influenced by emotions, cognitive processes, and past experiences. Now, let's take a look at neuroplastic pain. Number 1. Decoding the pain pathway. When pain is experienced, the body sends signals from the site of damage to the brain through a vast and intricate network of neurons. These signals travel along the spinal cord, culminating in the brain, which interprets and assigns meaning to the incoming sensory information. Neuroplasticity complicates this straightforward narrative. Over time, the brain's interpretation of pain can evolve based on the myriad of sensory inputs it receives. Number 2. The mechanism of chronic pain and sensitization. In instances of chronic pain, which persists long after an initial injury has healed, the nervous system can undergo a process known as sensitization. During this process, the brain's pain processing areas become more reactive and sensitive to stimuli. For example, a person with fibromyalgia may experience widespread pain that emerges independently of any observable injury, demonstrating how the brain can learn to perceive pain signals more intensely. Essentially, the brain rewires itself in a way that amplifies the sensation of pain, creating significant challenges for those affected. Okay. Next, we'll discuss the robust evidence supporting neuroplastic pain. Number 1. Innovative brain imaging studies, cutting-edge imaging techniques, particularly functional magnetic resonance imaging, fMRI, have illuminated the neural underpinnings of chronic pain. These studies reveal that individuals suffering from long-term pain exhibit altered patterns of brain activity in regions dedicated to pain processing, such as the anterior cingulate cortex and the insula. In some cases, these areas may show hyperactivity akin to that observed in acute pain scenarios, despite a lack of ongoing physical injury. Number 2. The interplay of emotional and psychological factors. Extensive research in the field of psychosomatic medicine has elucidated the profound impact of emotional states on pain perception. Conditions like anxiety, stress, and depression can amplify pain, creating a feedback loop where heightened pain levels lead to increased emotional distress, which in turn intensifies the experience of pain. Cognitive behavioral therapy, CBT, has emerged as a promising intervention, emphasizing the need to address these psychological elements. Through techniques designed to reframe negative thought patterns, patients often report decreased pain levels and heightened functional ability. Number 3. Neuroplastic treatment approaches. Various treatment modalities harness the principles of neuroplasticity to alleviate pain. For instance, mindfulness meditation has been shown to engage specific brain regions responsible for emotion regulation and pain modulation, fostering a shift in how pain is experienced. Similarly, biofeedback techniques enable individuals to gain awareness and control over physiological processes, facilitating relaxation and reducing pain perception. Virtual reality applications have also attracted attention for their capacity to distract and immerse patients in alternate experiences, showcasing the brain's ability to adapt to new stimuli. Number 4. Case studies and clinical evidence. Numerous patient narratives underscore the potential of rehabilitative programs designed to reshape chronic pain experiences. These approaches often emphasize the importance of movement reeducation, encouraging patients to engage in physical activities that challenge their pain perceptions. Through gradual exposure to physical exertion and cognitive reframing, many patients report significant reductions in pain levels and improvements in their overall quality of life. In summary, the extensive evidence gathered in recent years indicates that pain is not merely a passive consequence of injury, but rather a complex and dynamic neuroplastic experience. Understanding pain through the lens of neuroplasticity opens new therapeutic pathways and highlights the critical need to address both the physical and psychological dimensions of discomfort. By exploring and leveraging the brain's inherent capacity for change, individuals may find valuable tools to transform their pain experiences, ultimately enhancing their well-being and quality of life. Okay, now here's a list of traits of pain that is neuroplastic rather than structural. Number 1. Subjectivity of pain. Each individual's experience of pain is deeply personal, shaped by their unique psychological, social, and cultural background, making pain perception highly variable. Number 2. Adaptive role of pain. Pain serves a vital protective function, alerting individuals to potential harm and promoting behaviors that prevent injury, such as flinching away from danger. Number 3. Chronicity of pain. Unlike acute pain, which signals immediate injury, chronic pain persists for months or even years after the initial injury has healed, indicating a possible maladaptive response of the nervous system. Number 4. Central sensitization mechanism. This phenomenon occurs when the central nervous system becomes overly responsive to stimuli, leading to heightened sensitivity to pain, even in the absence of physical injury. Number 5. Altered pain threshold. Some individuals may experience pain at lower levels of stimulus than others due to heightened neural excitability, impacting daily functioning and quality of life. Number 6. Impact of emotions on pain. Emotional states, such as anxiety or depression, can amplify the perception of pain, creating a feedback loop where pain exacerbates emotional distress and vice versa. Number 7. Stress-induced pain exacerbation. Stress activates the body's fight or flight response, which can heighten pain sensitivity and contribute to the development of chronic pain conditions. Number 8. Cognitive behavioral influence. Residents' beliefs and thoughts about their pain, including minimizing, can significantly alter their pain experience, often increasing its intensity or duration. Number 9. Fear avoidance phenomenon. Fear of re-injury can lead individuals to avoid certain movements or activities, resulting in deconditioning and possibly further pain due to a lack of physical engagement. Number 10. Fluctuations in pain intensity. Chronic pain conditions often feature unpredictable spikes and drops in pain intensity without any obvious physical cause, complicating treatment approaches. Number 11. Memories of pain. Previous pain experiences can create a conditioned response, where the mere anticipation of pain can trigger an actual pain response due to learned associations. Number 12. Multisensory pain processing. Pain perception is a complex process that integrates various sensory inputs, visual, auditory, etc., leading to a richer, albeit more complex, experience of pain. Number 13. Distraction as pain relief. Engaging in enjoyable activities can serve as a distraction, substantially lowering perceived pain levels, illustrating the power of psychological engagement in pain management. Number 14. Social support modulation. Emotional and practical support from friends and family can significantly alleviate pain perception, highlighting the importance of social connection in pain management. Number 15. Cultural influence on pain expression. Different cultures have unique ways of expressing and managing pain, which can affect individuals' experiences and coping mechanisms. Number 16. Neuroplasticity's role. The brain's remarkable ability to reorganize and adapt itself means that pain pathways can change over time, creating new pain sensations that may not correlate with physical injury. Number 17. Phantom pain experiences. Individuals who have had amputations may report feeling pain in a limb that no longer exists, illustrating how the brain can remember pain even after the source is removed. Number 18. Unpredictable pain onset. Chronic pain can occur suddenly and without warning, making it difficult for individuals to anticipate or manage their pain levels. Number 19. Comorbid pain syndromes. Conditions like fibromyalgia and irritable bowel syndrome, IBS, show how multiple pain syndromes can exist together without clear structural underpinnings, complicating diagnosis and treatment. Number 20. Pain catastrophizing effect. Ruminating on pain and imagining worst-case scenarios can lead to increased pain perception and anxiety, creating a cycle that reinforces the experience of pain. Number 21. Immune system involvement in pain. Immune responses, such as inflammation, can play a significant role in pain perception, further complicating the relationship between pain and physical injury. Number 22. Relationship between fatigue and pain. Chronic fatigue can heighten awareness and sensitivity to pain, leading to a debilitating cycle where fatigue exacerbates pain and vice versa. Number 23. Impact of sleep quality on pain. Poor sleep quality is closely linked to increased pain perception, indicating that proper rest is crucial for managing chronic pain. Number 24. Variability in medication response. The effectiveness of analgesics can vary widely among individuals, influenced by genetic factors, metabolism, and psychological state, complicating pain management strategies. Number 25. Coexistence with psychological disorders. Chronic pain frequently co-occurs with mental health issues like anxiety and depression, which can worsen pain perception and treatment outcomes. Number 26. Lack of definitive diagnostic tests. For many chronic pain conditions, there are no objective laboratory tests or imaging techniques that clearly define the presence of pain, making diagnosis challenging. Number 27. Somatization phenomenon. Psychological stress may manifest as physical pain, leading to real sensations without any identifiable physical cause, complicating the therapeutic approach. Number 28. Gender differences in pain experience. Research shows gender can affect both the reporting and experience of pain, with women often experiencing and expressing pain differently than men. Number 29. Placebo effect in pain relief. The belief that one is receiving treatment can significantly diminish pain perception, illustrating the powerful role of expectation and psychological factors in pain management. Number 30. Behavioral modulation of pain. Changes in daily activities, such as increased engagement in physical exercise, can influence pain experiences by strengthening muscles or enhancing flexibility. Number 31. Alterations in neural pathways. Chronic pain conditions can lead to lasting changes in neural circuits, making the perception of pain more potent and difficult to manage over time. Number 32. Influence of immune response on pain. The release of certain cytokines during inflammation can heighten pain sensitivities, showing a complex relationship between immune function and pain perception. Number 33. Differentiated brain activity during pain. Functional imaging studies reveal that chronic pain engages various brain regions related to emotion, attention, and basic sensory processing, reflecting the complexity of pain. Number 34. Phantom sensations in pain disorders. Conditions such as neuropathic pain reflect the brain's ability to continue processing sensations in the absence of clear physical triggers, often leading to severe discomfort. Number 35. Subconscious pain processing. Individuals can experience pain without conscious awareness, influenced by stress or traumatic memories appearing in the background of cognitive processing. Number 36. Contextual factors in pain management. The environment, including noise levels, comfort, or emotional safety, can have significant effects on how pain is perceived and managed. Number 37. Development of unique coping mechanisms. Individuals with chronic pain often create specialized coping strategies tailored to their experiences, impacting their overall approach to pain management. Number 38. Unique pain mechanisms across conditions. Different chronic pain disorders exhibit diverse underlying mechanisms, requiring tailored treatment strategies based on specific pain profiles. Number 39. Lifestyle as a modulator of pain. Factors such as diet, physical activity, and social interactions play critical roles in the management and perception of chronic pain. Number 40. Learning-based pain processing. Past experiences can condition future pain responses, with learned behaviors influencing how pain is perceived and managed in the present. Number 41. Chronic pain related to neurological disorders. Conditions such as multiple sclerosis or stroke can produce chronic pain through complex neurological changes that do not relate to structural damage. Number 42. Collaborative treatment approaches. Effective pain management often relies on a multidisciplinary approach, integrating physical therapy, psychological support, and medical treatment for comprehensive care. Number 43. Impact of childhood pain experiences. Painful experiences in childhood can shape an individual's pain responses into adulthood, affecting their coping strategies and perceptions of pain. Number 44. Inconsistent symptom presentation. For many, the symptoms of chronic pain do not align neatly with the expected physical signs, adding complexity to diagnosis and treatment efforts. Number 45. Psychosomatic connections to pain. Psychological conditions can produce very real physical pain sensations, demonstrating the strong connection between mind and body in pain management. Number 46. Nonlinear progression of pain conditions. Chronic pain experiences are often characterized by erratic patterns of intensity, duration, and triggers, making them challenging to predict and treat. Number 47. Physiological responses to chronic pain. Chronic pain can lead to alterations in heart rate, blood pressure, and even digestion due to the body's prolonged stress response. Number 48. Role of community and environment. The communal and environmental settings can influence how individuals perceive and cope with pain, highlighting the socio-cultural dimension of pain. Number 49. Neural circuitry adaptations. Continued exposure to pain can lead to adaptations in the brain's circuitry, reinforcing pain signaling and making treatment more difficult. Number 50. The complex nature of chronic pain. The interplay of biological, psychological, and social factors showcases that chronic pain cannot simply be attributed to structural damage, but instead reflects a complex and multifaceted condition requiring comprehensive management. This elaboration helps showcase the intricate and multifaceted nature of neuroplastic pain, emphasizing its varied influences beyond structural factors.